Hello everyone, my name is Caesar and I'm here today with my teammates Derry, Luis, and Jesus as part of Team Ceretech. Today we'll be showcasing the development of our device, the T-Ventri Shunt, which is an endovascular cerebral ventricular shunt system that will be used to treat hydrocephalus.
To give some background information, non-communicating hydrocephalus is a condition that does not allow cerebral spinal fluid, or CSF, to move past the ventricles of the brain. If left untreated, the ventricles become inflated and the consequences range from something as simple as a headache to brain damage. However, through research we were able to identify that the ventricles can be accessed through one of the sinuses of the brain, specifically the transverse sinus. Reaching the transverse sinus would allow our team to create a method of reaching the lateral ventricles of the brain to allow for proper drainage of CSF. Moving forward, there is a large clinical need for an updated shunt system to treat this condition. 2 out of 1,000 children are born with this condition and 1 million Americans are currently affected. Current practices are invasive, prone to infection, and ineffective. Within the first year, 40% of shunts fail. Treating hydrocephalus costs hospitals in the United States a combined $2 billion.
So you may be wondering, how will the device be implanted into the patient? The image on the left illustrates a VP shunt placement, which involves drilling a hole into the patient's skull to access the lateral ventricle and guiding a short and long catheter along the skin into the peritoneal cavity for the CSF to drain into. However, our device will be introduced in through the groin area and diverted into the internal jugular vein. However, the right two images are MRI scans illustrating the measurements and angles needed for the device to successfully be implanted.
In order to tackle this complex anatomy, our group decided to come up with a 3-part solution. The first part is all about getting the angle from the transverse sinus to the lateral ventricle. Using titanium, we came up with this housing unit. Essentially, using curved tubing and a custom wire, along with a sheet, we came up with this system that'll not only protect the hole when moving through the system, but also allow the surgeon to place a stent to keep it in place and use a twist wire to make sure that the hole is orientated in the right direction. Arguably the most important part of this entire system will be the segmented pusher/needle. We designed this with the tip of the needle resting within the housing unit and having a series of segmented pusher pieces wrapped in a thin metal sheet pushing the needle upward, piercing the dura of the transverse sinus. The final part of this system is an anchor/catheter system. This will include a ventricular catheter that allows the flow of CSF from the ventricles down to the transverse sinus, and then an outlet catheter that'll take that flow and make sure that it actually reaches the transverse sinus, our intended goal. We also included an anchor system that will attach to the dura of the transverse sinus just so that the catheter system doesn't move around while the patient is also moving.
As of now, we are working to create a 3D printed model of our device in order to ensure proper fitting of all of our components and verify that our segmented pusher will deploy as intended. In addition, we plan to design and conduct compression and tension tests on titanium and stainless steel, which are the candidates for our needles material. We will also continue to update our clinical and technical mentors on our device and match any possible redesign requests until we can confirm a final prototype with them. It is also worth mentioning that we plan to keep in touch with Dr. Abruzzo for further development past graduation.